The effects of traditional weight loss exercise versus high-intensity interval training on fat loss in adults with overweight or obesity. Nearly 70% of American adults are either overweight or obese, putting them at increased risk for high blood pressure, diabetes, heart disease, and stroke. Just in order to be healthy, the American Heart Association recommends a minimum of 150 minutes per week of moderate intensity exercise or 75 minutes per week of vigorous exercise. The time required for weight loss exercise is even greater than this, and in order to maintain weight after weight loss, exercise at moderate intensity of a minimum of 200 to 300 minutes per week and 30 minutes per day most days of the week is required. The number one reported reason for failing to meet these weight loss guidelines is perceived lack of time. High-intensity intermittent exercise, high-intensity interval training, and sprint interval training are defined as exercise at near maximal effort in which repeated, short, high-intensity exercise bouts are interspersed with active or passive recovery. High-intensity exercise tends to rely more heavily on carbohydrate for energy than fat because the increased demand for energy exceeds the ability for fat metabolism to keep up. Moderate intensity continuous training or exercise, also called traditional weight loss exercise, is exercise performed at a steady state and usually 20 to 60 minutes long. Since lack of time is one of the primary reasons for Americans not to meet weight loss exercise recommendations, the purpose of this presentation is to evaluate whether or not high-intensity interval exercise could be a time-effective alternative to moderate-intensity continuous exercise for fat reduction. Six research articles were used to create this presentation, and all subjects were adults between the ages of 18 and 55 with BMIs greater or equal to 25 kilograms per meter square. All subjects were divided into 3 different groups with different exercise regimens. Each study lasted 12 weeks, although one study looking at short-term effects lasted only 5 weeks. Measurements included blood assays for serum glucose, hormone levels, plasma-free fatty acid, epinephrine, and norepinephrine, while body composition was determined using height, weight, DEXA, and a CT scanner. EPOC is a factor that can contribute to fat metabolism and stands for excess post-exercise oxygen consumption. It may be responsible for negative energy balance that is not accounted for in the caloric cost of exercise. It has been found that exercise duration affects the EPOC duration only, but exercise intensity can affect the magnitude and duration. While heart rate remained elevated longer post-exercise for high-intensity interval training, there was no change found between the two forms of exercise in the EPOC. No difference in energy expenditure post-exercise was found, but when including total energy expenditure both during and after exercise, MICT had significantly greater values than high-intensity intermittent training. No significant difference was found in estimated post-exercise fat oxidation. The 24-hour oxygen consumption was another factor looked at that can contribute to fat metabolism. It's the oxygen during exercise and the hours after that amount to a full 24 hours. During exercise and in the first 8 hours post-exercise, VO2 was 17% greater in moderate intensity continuous training due mainly to the oxygen consumed during exercise. From the hours after that until 24, VO2 in SIT subjects increased to about the same amount as the total VO2 values for MICT. While most VO2 consumption from SIT occurs post-exercise, 24-hour VO2 is similar in both forms of exercise. When looking at the results for catecholamines and hormones between the two forms of exercise, there was no differences found in adiponectin levels. No differences in plasmin interleukin-6 were found during exercise, even though both were elevated, but higher concentrations were found in MICT subjects 180 minutes post-exercise when compared to high-intensity interval exercise subjects. Both epinephrine and norepinephrine concentrations were higher in HIIE groups than MICT groups and returned to baseline 180 minutes post-exercise. Despite increases in catecholamines, there was no observed increase in lipolysis following SIT. When appetite was looked at between the two different forms of exercise, it was measured through hunger, fullness, nausea, and prospective food consumption. Immediately after exercise, feelings of hunger were lower in HIIE than MICT. Feelings of fullness and nausea were both higher in HIIE than MICT. Prospective food consumption was depressed in HIIE. Based off of this, SIT appears to have a greater effect on appetite and depressed post-exercise food consumption than other forms of HIIE, but both have a higher positive effect compared with MICT. No differences in food consumption 1 hour post-exercise was found between groups. The last factors that were looked at that can have an effect on fat metabolism were RER, plasma free fatty acid, and glycerol. Exercise RER was greater in SIT than MICT, while post-exercise RER was greater in MICT than SIT. This means that more fat was being used as substrate during the post-exercise period in SIT than MICT. Plasma-free fatty acid levels were elevated in MICT compared to SIT groups 60 minutes post-exercise. No difference was found between groups for plasma glycerol, both were elevated. The lack of increases in the free fatty acid in the SIT group may be the reason that increased catecholamines did not have an effect on lipolysis. When looking at the effects of different forms of exercise on total body mass, both MICT and HIIE resulted in equally significant body mass reduction when they were performed with the same energy expenditures, according to one study. Another study showed that there was no difference in body mass between high-intensity interval exercise and MICT when energy expenditures were not equalized. High-intensity intermittent exercise was performed for 20 to 24 minutes 3 days a week, while MICT was performed 36 to 48 minutes 3 days a week. When looking at total body fat percentages, one study found that both moderate intensity continuous training and high intensity intermittent exercise resulted in greater than 10% body fat reductions in a 12-week period when performed with the same energy expenditures. Another study found similar results in that HIIE only resulted in the same levels of fat percent reduction as MICT when they were performed with equivalent energy expenditures or a time duration that was about 60% of the time allotted to MICT. It was also found, though, that HIIE also resulted in increases in cardiovascular health. Another study found that percent body fat was reduced in MICT by 2.6 plus or minus 1.1%, but it was not significantly reduced in high-intensity intermittent exercise, although in this study, energy expenditures were not equalized. When body composition was compared between exercise groups, both MICT and HIIE resulted in equal abdominal visceral fat reduction when performed with equivalent energy expenditures. Intra-abdominal visceral fat has been proven to be a strong predictor of hyperlipidemia, insulin resistance, and metabolic syndrome, so it's important to look at this area specifically. There was no difference in lean body mass between the two groups, but in this study, energy expenditures were not equalized. Android fat was reduced only in MICT, but this study, again, did not equalize energy expenditure. In the same study, gynoid fat was reduced in both forms of training, but was not statistically significant. High-intensity intermittent exercise is appealing because of its time effectiveness, and while most of these studies looked at these exercises over a 12-week period, one study in particular looked at 5 weeks of training. Short-term HIIE and MICT resulted in no changes in body mass, total body fat mass, BMI, or hormone levels, even though overall energy expenditure was significantly lower in high-intensity intermittent exercise groups. MICT resulted in lean body mass reduction, though. HIIE had a lower rate of perceived exertion, which could also be seen as an appealing trait. Short-term MICT and HIIE resulted in no changes regarding body mass or body composition. Overall, while largely and recently studied, the mechanism for fat metabolism surrounding high-intensity intermittent exercise is unknown. While it is unlikely that EPOC is responsible for the fat reduction that occurs with HIIE, fat burning does most likely occur during the recovery period and could be due to the resultant appetite suppression that occurs. There are varying results from different studies with regard to fat reduction. However, overall it appears that HIIE does provide similar benefits to MICT, but only if performed with equivalent energy expenditure or a similar time commitment, which is about 60% of the time, but the differences are small. Therefore, high-intensity intermittent exercise is probably not a time-effective way to improve fat reduction by replacing MICT, but further research does need to be performed. High-intensity intermittent exercise does, however, improve cardiorespiratory fitness, and so if the person's goal is to decrease risk factors and decrease fat reduction, the possibility that HIIE could be beneficial is there.